My name is Janelle and I will be doing an examination on Dougal. I'll have Caitlin as my assistant as well. So first we'll perform our distance evaluation. We can notice that the eyes, there's no eye discharge, the eyes are symmetrical, and there's no squinting. By the nose, there's no nasal discharge, and the nares are also symmetrical. Now to perform our ocular examination, we can see that the eyelids have no inflammation or masses. Raising the lower and upper eyelids, we can see that the conjunctiva is pink, no trauma or injury. The sclera and the fornix are white and clear. The cornea has no discoloration, it's clear, there's no trauma, as well as the pupil and the iris are clear. Now we will retract the third eyelid and notice that there's no trauma, discoloration, or injury. Now we will perform our menace response. Perfect. And our palpebral response as well. Beautiful. The oracle exam, examining the ear. There's no redness, inflammation, or temperature change. The external ear is nice and clean, and the internal ear has a bit of hair, but no ticks or fleas or injury. Now we will do our oral examination. Lifting the upper lip and going all the way to the back, we will notice very good dentition, as well as pink, moist mucosa, and a capillary refill time of less than 2 seconds. Opening the oral cavity and sweeping under the sublingual. There's no masses or any foreign bodies. We will now take a look at our mandibular lymph node, which is symmetrical and small, cute, and bean-shaped. Our prescapular lymph node is also symmetrical and small. Our axillary lymph node, our inguinal lymph node, and our popliteal lymph node. Beautiful. I'll now palpate the trachea for any abnormalities, and now I will perform an auscultation to begin my respiratory examination. I'm listening for an inhale and an exhale. Sounds good. I'll now listen to the 4 quadrants of the thorax and listen for any abnormal respiration. And I'll do the same on the other side. I will do my cardiovascular auscultation, taking a heartbeat and comparing it with the femoral pulse. Perfect. I will also listen to all 4 valves, so pulmonary, atrial, mitral, and tricuspid. Perfect. I'll now begin my abdominal examination. Starting behind the last rib. It is soft and no pain. Perfect. And now I will do my proprioception of the forelimbs and of the hind limbs. Now we will have him in lateral recumbency. 1, 2, 3. We can note that there's no mass on the abdomen and the skin is just recovering from allergies. I'll perform the cranial drawer test. So I've got the tela and the tibia, and then I will push cranially. So this is a negative cranial drawer test. Perfect.